Hey there, everybody, and thank you for watching. I'm Will DuPree.
And I'm Amanda Dugan. This is KXAN Live News Notes. We're going to break down the big stories of the day. We're going to do it in less than 5 minutes.
Starting off, we're talking about something that Dr. Mark Escott, the interim health authority for Austin-Travis County, has discussed lately, that we've seen a plateau in new hospitalizations related to COVID-19.
That's right. So 3 major Austin Metro hospital systems say 70% of their beds are full. Nearly 80% of all ICU beds are full.
Taking a look at the data now, our 7-day average of daily hospitalizations is significantly down to 37 new hospitalizations each day.
330 people total are in local hospitals with COVID-19.
Meanwhile, there are a little more than 6,600 active cases in our area.
And most of those are in Hays and Travis counties. You can take a look at that right now.
Austin's top health expert, Dr. Mark Escott, as we mentioned a moment ago, said the community needs to at least be at stage 2 level of COVID-19 risk, and that's needed in order for schools to do in-person learning safely.
Now, keep in mind, right now we are in stage 4. Escott says school superintendents in Travis County are already looking over Austin Public Health's recommendations. APH is pushing for schools to open at 25% capacity.
Dr. Escott says this will help schools sort out how to make in-person learning work.
How the classrooms are set up, how students move throughout the classrooms, the hand washing stations, how they're going to feed students, how they're going to bus students. These things can't be worked out effectively if we open at 50 or 75%.
The state says it is up to each school district to decide how it wants to operate. Dr. Escott says he's confident school districts will follow APH's guidelines.
When it comes to COVID-19 testing, BUTA will join CVS's Ready Return program. The system tests for COVID-19 before employees actually return to work.
Yeah, so city leaders, they approved the plan last night to test city employees and also offer these tests to assisted living workers. Let's break down how it works. So CVS consults with businesses to decide who they want to test and where it'll happen.
Then CVS gets medical professionals to conduct that testing. Once results are in, businesses use that data to monitor and manage the spread of the coronavirus.
Now, this partnership, it may cost BUTA more than $300,000. I'll be curious to see if any other cities pick that up, too.
That's for sure. Turning to other news, Austin police are looking for a 4th suspect in connection to a death of a beloved ice cream vendor in East Austin.
That's right, Alejo Urias. APD shared information yesterday about the suspects who already face capital murder charges. Marquise David, Jermaine Jones, and Devlin Wardy are being held on $1 million bond.
Urias was robbed and shot while pushing his ice cream cart around a North Austin apartment complex in June. Police say some people were hesitant about giving statements because they feared retaliation.
But some witnesses did end up coming forward because they were so upset about Urias' death. Detectives believe the 4th suspect was a getaway driver. We do not have a description of that driver's car, but I know that has shaken a lot of people in the North Austin community.
Urias is no longer a tropical storm at this point. It's now in Canada after leaving its mark all along the eastern coast of the United States.
That's right. Millions of people were affected by this. At least 5 people, sadly, are dead in multiple homes and businesses damaged along the eastern. I mean, just look at the way that storm rolled in. And now in northeastern North Carolina, Urias spawned numerous tornadoes, too.
Homeowners say it hit really fast. As many as 2 million people across the East Coast are without power.
You know, as much as we try to prepare for Mother Nature, it's just, you can't predict how something like this is going to play out.
Yeah, our thoughts are definitely with them. One final story to share. A Texas State University donation will actually help save lives all across the state of Texas.
That's right. We need some good news, right?
We
do. The university donated 3 ventilators to an organization that coordinates organ donation. The Texas Organ Sharing Alliance didn't have enough ventilators at its facility in San Antonio, so it reached out for help. And thanks to Texas State's ventilators, 6 organ donors helped save the lives, get this, Will, of 19 people.
Amazing.
Good stuff.
We thank you all for watching. I'm Will DuPree.
And I'm Amanda Dugan. Enjoy the rest of your day.